Well, the opportunity is wonderful in that we are able to provide support for some of the particular health needs that we have locally. Our faculty and staff, we were getting news of problems that they were having healthcare support. Our students are well served by having a clinic on campus, but we became sensitive to the problems that we had with a lack of resource for faculty and staff. And then as we became more and more aware of that, we realized that that was not just a local problem, that also extended to the wider community. And so it became a real burden for our nursing faculty to be able to have an opportunity to have a ministry within the community. Instead of them going further afield, we wanted to be able to offer that and model that for our students and be able to have the students engage in that partnership with our faculty and be able to offer those kinds of community partnership in ministry. And so as nursing students watch what goes on in a nurse-led clinic, that is really a true ministry of caring. That is really what the opportunity is through the nurse-led clinic. And so it will be a walk-in clinic as well as by appointments. And so students will be able to see how to assess properly, how to care for urgent and non-urgent problems, health problems. We will refer for emergent problems just as you would with any nurse-led clinic. And we are partnering with our agencies in the area to make sure that we have all of our due process with other kinds of referrals.
So a great opportunity then, a great learning experience for the students here that are going to come through the nursing program here.
It is. It's a great opportunity. And one of the things that's very difficult to support students learning in because of the pressures with working in the healthcare environment is electronic medical record systems. And so we have an electronic medical record system as part of the clinic, which is really a standard protocol now. But it gives students time to work with that system and become familiar with the rigors of data entry and how that really will develop an expertise and give them a confidence in working with electronic record keeping that will then prepare them in a more efficient way for working in a hospital environment. So we think that this is a wonderful way of also enhancing their clinical preparation here at Louisiana College.
And finally, if someone wants to take part in this clinic, wants to come and be seen here, what do they need to do?
They just either need to call the clinic number, and we'll provide that as part of this broadcast, and we will make that available. And or they can just show up at the door, and we will see them between the hours of 8 and 4:30.
Good deal. Anything else you want to add I haven't asked you about?
We are just excited that administration at Louisiana College have been willing to allow us to use this as a ministry opportunity. This is a way of giving back to the community. And the students and the faculty alike are just excited by the potential of helping with meeting some of the healthcare needs within Cenla. And I think that this is going to be a wonderful benefit for the whole of this area, and so we're excited with the possibilities.
Are there any costs involved for people that come? I mean, do you have that worked out, or how's that?
We have a sliding scale of payment that is commensurate with meeting people's needs, and so that the documentation on that is provided through some of the literature that we're making available through the clinic. And so Medicare, Medicaid, we're funded through them, as well as insurance premiums, and so you have your usual copay that's set up through that protocol. And then if you have a sliding scale based on what your level of income is, we do make adjustments that way. And then as we begin to grow and have revenues coming into the clinic, we do have a plan to have funding for those who really do not have an opportunity to have those revenues in hand, so that we would really have a true charity outreach, and that is part of our long-range plans for community involvement. So that's going to be part of what we're doing.
Talk about the way this really models the integration of faith and learning that's so vital here at Louisiana College.
Well, we've had a intensive program of the integration of faith and learning with our curriculum development with our students. And that is in every clinical course, students are challenged to using Galatians with the fruits of the Spirit to identify in their journaling that each fruit of the Spirit is really identified in how they work with their patient groups and also how they model that in their own lives. And so joy and peace and goodness and gratefulness and each of those fruits of the Spirit in terms of how they engage in patient care. And then as they look at biblical character qualities and develop those and identify which one they feel is most important for them to work on through the nursing program, they look for evidence of that in terms of their interactions with faculty and staff and people that would model that for them through Scripture. And as they graduate now at Pinning, our ceremony, which is 2 o'clock on on Friday, they have a ceremony where they voted on the biblical character quality that they see in one another, and they're presented with a certificate of the biblical character quality that they have seen in one another. And that certificate is presented to them. And so we're hoping that those steps by challenging students to model what Christ would have us be in our day-to-day walk, and is modeled also through our interactions through the nurse-led clinic as we work with students in a way that really reflects what the Lord would have us do, is really going to be an example of our ministry of caring. And that's we're not here just to train nurses to do a job. We are here to help nurses to really understand that nursing is a ministry, and that ministry is to care for the ones who are unloved. And that is really what the outreach opportunity is through the Loving Care Nurse-Led Clinic.